Hello, everybody. My name is Stacy Vandergriff, and I'm the health coach here at Symbol Health Clinic in Albertville. And we service all of Mitchell Grocery employees. Today, we're going to be discussing skin cancer awareness. As you all know, you'll earn credit for attending this health break. You'll receive either 25 wellness points or one ticket if either of those apply to you. And I just want to thank everybody for joining us today. Okay, so we're going to be discussing what exactly is skin cancer. We'll go over the three major types of skin cancer, the statistics of skin cancer, the characteristics of melanoma, knowing your ABCDEs, knowing the risk factors, the diagnosis and treatment of skin cancer, and the prevention of skin cancer. We'll also be taking a look at the Environmental Working Group website and exactly how to read a sunscreen label. Okay, skin cancer is the most common cancer in the United States and worldwide. More people are diagnosed with skin cancer each year in the United States than all other cancers combined. Basal cell carcinoma is the most common form of skin cancer, with an estimated 3.6 million cases diagnosed in the United States each year, and squamous cell carcinoma being the second most common form, with approximately 1.8 million cases each year in the United States. Each year, about 6 million people are treated for skin cancer, and about 8,000 people in the United States die from melanoma. It is estimated that the new cases of melanoma diagnosed in 2025 will increase by 5.9%. More than 2 people die of skin cancer in the United States every hour. These statistics are startling and makes awareness of this disease even more important. It can not only take a significant toll on our health, but on the healthcare system and on our wallets. It is reported that nearly $9 billion is spent on skin cancer treatment in the United States each year. So what is skin cancer? It's the abnormal growth of skin cells. This type of cancer is one that mostly develops on skin exposed to the sun. Frequent exposure to ultraviolet light from the sun or the tanning bed is one of the most important risk factors for most forms of skin cancer. There are also forms of cancer that can occur on areas of your skin not ordinarily exposed to the sunlight. The three major types of skin cancer are basal cell carcinoma, squamous cell carcinoma, and melanoma. The most common type of skin cancer, squamous cell carcinoma, and here's a picture of it, of what it could look like, is the most common type of skin cancer and forms in the outermost layer of the epidermis. It can look like open sores, red patches, or shiny bumps. It grows slowly and in most cases are curable and causes minimal damage when caught early and treated early. Squamous cell carcinoma. This develops in the cells that are closest to your skin surface and is the second most common type of skin cancer. It may appear scaly with red patches, open sores, or warty growths. Can increase in size and spread to other parts of the body also. The third type is melanoma. This is the most invasive skin cancer with the highest risk of death. It starts in the melanocytes. Like the other types of skin cancer, melanoma typically starts on skin that's often exposed to the sun. One UK study found that about 86% of melanomas can be attributed to exposure to UV radiation from the sun. Melanoma can be really dangerous because it can spread beyond what you can see, moving deep into the skin, where it can get access to your lymphatic system and blood vessels, increasing the chances of it spreading. The most common misconception with skin cancer is that mostly fair-skinned people are susceptible, but with melanoma, it's more common in people with black or brown skin. So over 2/3 of melanomas are diagnosed among adults aged 55 and older. When detected early, the 5-year survival rate for melanoma is 99%, which shows the importance of prevention. And also, this one has kind of touched my life also. My dad had found a spot, a growth on his leg. He was an avid golfer, was in the sun a whole lot, and had noticed something just right above his where his sock line was. And it was a growth that had started to change. And so my mom kind of pushed him to go to the doctor and get it seen about. And then they had taken a look at it, did some biopsies and things like that, and come back that it was melanoma. They then had to do the lymph node biopsies, and then those come back, a couple of them actually came back positive. So it had already started to spread. And so he ended up having to do interferon treatments, which is just a type of radiation that ended up saving his life. So yeah, it could have been really bad, and it was caught early. And that's the main thing about all of this is early prevention, is when you feel like something is off, make sure that you get it seen about, because he didn't have any other problems after that. After he went through his treatments, he was okay. So early prevention is really important, especially when you're dealing with melanoma. Okay, so the characteristics of melanoma, it's very important to know your ABCDEs. And the A stands for asymmetry, and it just means irregularly shaped growths. B is for border, and that's the blurry shaped edges. C is for color, and that's the moles with one or more color. D is for diameter, and that's the growths that are usually larger than a pencil eraser, around 6 millimeters. E is for evolution. That's growths that are enlarging and changing in shape, color, or size. And you may have all of these characteristics, but just having one warrants getting it checked out. So the top line here is showing the non-cancer, the benign growths. And then the ones on the bottom here are showing the melanomas and what they look like. So it's important to know your risk factors. You may be more at risk if you've had skin cancer or you've got a family history of skin cancer. If you tan or if you've used tanning beds, if you're easily sunburned or have a history of sunburns, if you have several moles or irregularly shaped moles, if you take medications that suppresses or weakens your immune system, if you live in a sunny or high altitude climate. And just remember, if you're a smoker, you're always you're going to be 1.5 times more likely than non-smokers to develop skin cancer. So it just increases that risk. The diagnosis of skin cancer may often start with an examination of your skin. A healthcare professional might remove some skin to biopsy and send off to a lab to see if the sample contains cancer cells. If it's positive, they may need to do other tests to find out whether the cancer has spread. There are other tests that may be involved in this step, like imaging test, lymph node biopsy, and cancer staging. The stages of skin cancer range from 0 to 4. Exactly what that means, that number means, depends on the type of skin cancer and where it is on the body. And here's an example of them showing they're doing a biopsy of the skin. So the treatments for skin cancer. You may receive one treatment or a combination of treatments depending on the type and the stage of the skin cancer. This could be different for everyone. Some treatments include surgery, topical treatment, chemotherapy, radiation, and immunotherapy. There's also targeted therapy, which works by seeking out specific characteristics in cancer cells, such as gene mutations. Targeted therapy drugs are designed to attach themselves to those cells to kill them or help other therapies, such as chemotherapy, work better. Some targeted drugs have been approved to treat the more aggressive form of skin cancer, like we had just talked about, called melanoma. Prevention is the most important part of any disease process. By being diligent in knowing your risk factors and adhering to the prevention guidelines could make a difference between preventing disease from occurring and even from death. Remember your ABCDEs and examine your skin from head to toe every month, being aware of any new growths or changes in sunspots or moles. See a dermatologist if anything new arises or any growth changes, and have an annual full body exam if you feel like you're at an increased risk. Use broad spectrum, water resistant sunscreen with an SPF of at least 30 or higher. Remember, water, snow, sand, and other surfaces reflect the intensity of the UV radiation and increases the chances of getting sunburned. Most people don't wear enough sunscreen to get the SPF protection advertised on the bottle. So apply at least 1 ounce of sunscreen per application and reapply often, especially if you're getting wet or you're sweating. Protect your face and the back of your neck with a brimmed hat. Always try to cover parts of the skin that's been exposed the most to the sun. If you are someone who prefers not to use sunscreens, just remember the most important thing is to stay in the shade as much as possible when the sun is at its strongest, and that's usually around 10 a.m. to 4 p.m. Understanding the sunscreen label, it can kind of be a little bit confusing. There's a lot of things that you see on the label. But when you see the SPF, this stands for sun protection factor. It's a measure of how well a product will protect us from UVB rays, the main cause of sunburn, but doesn't account for UVA rays, which is still harmful to our skin, causing skin cancer and wrinkles. And again, aim for a SPF of 30 or more. You may also see broad spectrum, which is a term that is defined by the Food and Drug Administration. It is used on products intended to protect from both UVA and UVB rays. But even products that say that they're broad spectrum coverage may fail to meet the UVA protection standards set in other countries. The active ingredients are the ingredients that actually do the work. Look for products that have zinc oxide or titanium dioxide. Avoid those that use oxybenzone. It's also been banned in other countries for health and environmental concerns. The inactive ingredients are the ones that may help stabilize a product, add the scent or moisturize, or change its consistency. Avoid sunscreens that include retinol palmitate, which may be detrimental to our skin's health. When you see the word fragrance, make sure that the product is also EWG verified. Otherwise, it could have ingredients including hormone-disrupting phthalates. You may see water resistant, and this is just a heading that you'll see when it's being labeled water resistant. They must test the product for SPF after having spent 40 minutes in the water or 80 minutes to be considered very water resistant. And just like with most diseases, diet and lifestyle and physical activity plays an important role in prevention. Eating a less processed, more whole foods diet, getting optimal sleep, and engaging in regular physical activity is a step in the right direction. Making sure that we're doing everything in our power to hopefully prevent disease and give our bodies everything that it needs to operate optimally. Skin cancer can not only significantly change the course of your health, but can cause an erroneous strain and cost to the healthcare system. Knowing your risk factors and how to prevent sun damage is key to prevention. Also, examining your skin every month and having a yearly skin exam with a dermatologist will hopefully increase your chances of a better outcome. The Environmental Working Group, or EWG, is a nonprofit, nonpartisan group dedicated to protecting your health and the environment. They strive to empower people to live healthier lives in a healthier environment. They work to provide you with all of the resources you need to make an informed decision on products and services. Always look for the EWG verified mark, which means the product has met the strictest health and effectiveness standards. They also have an EWG app that you can use. So whatever product that you're wanting to see if it meets their standards, you just scan the barcode and it will tell you their rating. They offer the latest research on products and services to help you make an informed decision on what you feel good about using for you and your family. From your water to pesticides on your fruits and vegetables, to your cosmetics and even cleaning supplies. So it's a very useful and helpful website that we can use to try to choose the healthier things for us. So we're going to take a look at their website, and we'll go over and just look at some different sunscreens also. Okay. All right, so here is their website. And like I was saying before, there is a database for actually water. You can check, you can put in your zip code and just see the contaminants and the things that are in your local water, which is super helpful. We'll be looking at the sunscreens in just a moment. And they also have a shopper's guide for your fruits and vegetables to pick healthier things. There is a database also for your skincare, anything that you put on your skin. There are thousands of different cosmetics and lotions and things that you can look up. And also from, the cleaning supplies that we use, anything that we're breathing in or putting on our skin, we need to be checking. So we'll take a look here at the sunscreen, different ones here. Okay, so one we're going to just pick that's pretty common. It's called Banana Boat. And this one is for kids. It's called Banana Boat Sunscreen Lotion. It's got an SPF of 60. Now, their rating system goes from 1 to 10, 1 being the best ranking, 10 being the worst. This one is ranked a 7. So, and then if you want to know why, you can look on here and it will tell the exact health concerns that they're worried about. So as you see here for this one particular product, the health concerns, it's low in cancer, but very high in allergies and immunotoxicities, moderate for developmental and reproductive toxicities, and the use restrictions is high. Now for the efficacy concerns, just meaning how effective the product is, there's some cautions here. They will list those for you. You can always click on here and see exactly what they're talking about. So the 4 concerns that they're saying is based on their modeling, the UV protection is significantly lower than the SPF value would indicate. So having an SPF value above 50, it just offers a false sense of security. This one also has its chemical active ingredient. It has some ingredients that the FDA does not have enough health safety data to classify it as safe. And some of these are actually known carcinogens. So we want to really be careful about some of these products or some of these ingredients that are in our products. So then they'll go on even to list each ingredient. And then they've done research on each of those individual ingredients. So you can choose what, you feel safe using. Now, as you see, all of these are green, so they're pretty decent ingredients so far. But then there's one that kind of sticks out. This one's a 3, but there's one that's a 9, ranked a 9, and it's propylparaben. So you can click on here just to see what they mean. What are the concerns for this particular ingredient? And this is the concerns are the allergies and immunotoxicity is moderate. The use restrictions is moderate. The endocrine disruption is high. And that should alarm a lot of us because then we know that it's disrupting our hormones. The ecotoxicology is low, and that's just how it affects our environment. So again, you can take a look at this and you can choose what you feel safe using on yourself and your family's body. So, and there's the rest of the ingredients. And again, the score there. Here's the EWG verified mark to look for. So when you see a sunscreen that is marked EWG verified, you know that it meets the EWG's criteria for overall product hazard score. It's formulated to provide balanced UVA and B protection. It doesn't contain any ingredients that are on their unacceptable list, and it discloses all ingredients, including those with fragrances. So there is one that's not verified. So now we're going to take a look at one that is. And you can sort this several different ways. You can just go straight to ones that are verified. You can look at recreational sunscreens. You can filter it by, just daily use SPF. If you want one that's specifically mineral-based or non-mineral-based, you can click on there. So there's different ways to do this. So we're going to take a look at one that is, of course, and this is Attitude. And this one is a mineral-based face stick. It's unscented, so it doesn't have the fragrances. Its SPF is 30. So this product bears the EWG verified mark, and that just means that this product meets the strictest standards for health and safety. And it avoids any of the ingredients on their unacceptable list. It provides full transparency of ingredients, including the fragrances. So the ingredient list is here. And again, this one is, as you can see, it's a mineral base. So there's zinc oxide, there's different ones on here. And then if you want to know more about each one of these, you can click on the plus here. And it just tells you with zinc oxide specifically, it's very low in cancer. Developmental reproductive toxicity is low. The allergies and immunotoxicity is moderate. Use restrictions is moderate. Persistence and bioacclimation is low. So it gets pretty in depth in each ingredient and what they, feel is good or bad about that particular ingredient. So it goes on to list the different ingredients there. And then if you want to know, where you can buy these products, you can look here and there's links. You can just click on the link and go straight to Amazon if you want to and order this particular one. So again, it's just very helpful to have a website that you can go to as far as your products that you use, your drinking water or your fruits and your vegetables, things that you choose at the supermarket. It's good to have this place to come to and to look and just see how it stacks up to other products and choose the better one, the one that you feel is better for your family. Okay. All right. And so, Kevin, you want to jump in there?
Thanks, Stacy.
Mhm.
All right, I just wanted to mention a few positives about the sun. After hearing all that scary stuff, we do want to be realistic. We don't want to hide away from the sun for a few different reasons. We need the sun to help our body manufacture vitamin D, which is needed to absorb calcium for our bones, and most importantly, it's needed to boost our immune system. So we do need to get some sun. The recommendation is several days a week. And even more so in the wintertime when we're wearing more clothing and when the UV index is much lower. We need to find balance, be sensible, just don't get burned. All the advice here that Stacy's given today is a really practical, realistic approach to protecting ourselves, and it doesn't have to be a chore. One recommendation I have is if you're unsure about the UV index, you can use any weather app, like the Weather Channel app, to track the UV index throughout the day. It can tell you how long exposure can cause a sunburn. Sometimes it will say in just as little as 12 minutes. Say you're out there at 1 o'clock and the UV index is 11, which is the highest. That's when you want to be most careful. The scale works like this: 0 to 2 means low, 3 to 5 is moderate, 6 to 7 is high, 8 to 10 is very high, and 11 plus is extreme, and that's when we should probably be getting shade and putting some clothing on at that time of the day. The EWG products, they're not easy to find in stores, so it's really the best thing is to use the website to order some products if you can't find them, but also to use the EWG app, which is called Healthy Living, like Stacy mentioned, and just go to the grocery store and start scanning different products to see which is best in your local area. That's the best thing that you can do. So thanks for your time. I'll let Stacy wrap it up.
Okay, we just want to thank everybody for attending today. And and I guess the main takeaway from this is, make sure that you're utilizing your Symbol Care clinics. We can always refer you out if need be, but if something is off a little bit, just always, be on the safe side and just get it checked out. But thank you so much for attending.